That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Well, hey everybody, welcome back. I am Amir Rashidian. This is Brandi Rashidian. This is Real Health with Brandi and Amir.
Yep.
And this is where we teach you how to feel better, get stronger, live longer, and feel
younger.
Now,
we actually both experienced an aging event since our last podcast.
it was a moment,
Yeah.
aging moment,
Yeah, I think I went backwards.
for sure.
How about you?
I stayed where I was.
So we're both a year younger than
That's
we were
right.
last time.
That's right. So
So
yes,
maybe it was an anti-aging event.
yesterday I turned 49. And
Happy birthday.
Thank you very much. Happy birthday to you. Yours
Thank you.
was 9 days prior to mine.
That's right.
And this is actually, I put this here because this is one of my birthday presents. It's a mug, and it says, "I will look for you, I will find you, and I will make you do your exercises." So, cheers.
Love it. And that's very much
So-
your personality.
I am Dr. Amir Rashidian. I'm a chiropractor. Brandi is my other half. And what we do on this podcast, as hopefully you know, is we read and summarize the latest news information regarding health. And then we discuss that and tell you how that applies to you, how you can use it to make your life better, improving quality of life and relationships and so on. So health is important, and
It
that's
is.
where we focus. So we have a few articles. We have a lot of articles because we, even though we've been posting every week, we took a couple weeks because we were traveling, and we got to see Tom Brady speak. That was very
He's now
nice.
one of my new favorite people. Sorry, Tom, I didn't pay much attention to you before, but
While he was playing football, yes.
but
So
now, gosh, what a great story. So if
he-
you don't know his story, I'm sure he has a book.
Yep, but we were not going to talk about that too much. He's a good guy. He does take care of his health very much. Drinks, 3 gallons of water every day, he said?
Yeah, he inspired me. I'm now drinking a gallon.
Now, yeah, we're up to a gallon each, so that's good. So if we have to take a bathroom break, that means the kidneys are functioning. Speaking of that, here's our first article. It's from Healthline, and the title of the article is "Daily Screen Time Tied to Developmental Delays in Toddlers, a Study Finds."
I was really excited that this article came across our desk because I got to use it today in the car with the kids as they were trying to come at me with a different angle to get additional screen time because we don't let them have screen time during the week when school's in session. So I got to jump back to this article and go, remember how I keep telling you mushy brain is what devices cause? Now we have proof. So let's dive in.
There you go. Very good. Now, our kids are all older than the kids in this study, but we don't have to tell them that. A new study found that longer screen time at age 1 was linked to developmental delays in communication and problem solving at ages 2 and 4. So this screen time at age 1 affected their ability to communicate and problem solve at ages 2 and 4. I guess they skipped 3-year-olds. I don't know.
Yeah, that's interesting.
So I'm sure it's just the way it's written. It's from 2 to 4. Experts say limiting screen time in infants and young children can support their development. Some forms of screen time may be appropriate for children 18 to 24 months of age. 1-year-old infants with longer screen time had a higher risk of developmental delays in communication problem solving at ages 2 and 4, according to the study, and it actually affected their social skills as well. Developmental delays at age 2 and 4. So in the study, they took 7,000, almost 7,100 children in Japan. So I wonder if Japan's screen time is more. A lot of screens come from the Far East. But the study took 5 years, from 2013 to 2017. By age 2, those who spent 4 or more hours a day with screens. At first I go 4 or more hours is a lot, but then I go, it's actually not. I mean, kids do spend.
We know how easy it is for that to occur, even with us.
Yeah.
Right? If we go and dive into our screen time, how
Right.
much we
Yeah.
access.
Yeah.
Now, granted, we're answering emails, we're, doing stuff for business, but it's still screen time, regardless.
It's
so,
true. That's true.
I think it's easy to
To go
create
over
that.
4 hours a day, yeah. With screens, almost 2 times more likely to experience developmental delays in communication and problem solving. Those who spent 4 or more hours per day with screens were almost 5 times more likely to have communication delays and almost 3 times more likely to have problem solving delays by age 2. In addition, those with 4 or more hours per day of screen time were up to twice as likely at age 2 to have delays in fine motor skills and personal and social skills. By age 4, the increased risk of delays remained only for communication and problem solving. So it seems like by age 4, the social skills and fine motor skills caught up to where they should be, but the problem solving skills and communication did not improve.
Well, that's also this is just the thought that comes to my mind when you say that, is that by the time the kids are 4, 5, isn't that when they're typically more in social settings?
Right.
Right? That's part of the problem with devices and with social media. And while there may be benefits, so don't start throwing tomatoes at the screen yet. The reality
They're
is,
watching us
I
on
know.
a screen.
I know.
Turn away.
Just listen to
Look
us.
away.
Close your eyes. Oh, I'm sure there will be an article about what we hear
I
too.
doubt 1-year-olds are watching us.
You never know. Well, that would
If you're watching this,
be
you're less than
educational.
18 months old. You need to stop right now.
Or bring your mom over so she can watch it with you, because that changes the impact.
Yeah, that's true. That's what it said.
We'll see that in the article here. So, I think when we're talking about social media and devices, part of the issue is it is something that takes us into a solitary time frame in our day or in our life, because although we are connecting with people everywhere else, right, we're really not. It can be very isolating, and I think that that's probably partially what they're seeing, and why the social aspect isn't there, because there's nobody to interact with.
Right.
Now, that changed in the study, according to the article, when a parent was watching
When
with
you
them.
sit with your child and you watch with them, you stop or you pause, or at the end of it, you discuss it. And what'd you
Right.
learn? What'd you think? How'd you feel about that?
So you change that from being an isolating, non-educational opportunity, right, to being an engaging, interactive educational opportunity.
When I said educational shows did not affect the kids as much as purely entertainment.
Yeah.
I learned English watching Sesame Street. So,
and we know how Sesame Street, how much data and research they put into every second of that show.
That's right.
Knowing what children, how they could be engaged.
Yeah, they actually put cameras behind the screen, and the camera focuses on the child's eyes, and they know what corner of the screen the child looks at and for how many seconds. That's why every segment is timed exactly. If it's 82 seconds, then you need to switch topics. If they're studying the letter B, it'll be in the top corner, but then they'll know when to move it to the bottom left and so on. It's very interesting.
Yeah.
But I wasn't a child when I was 11 years old when I was trying to learn English when we moved to the U.S. So, but I was watching kids shows. It helped.
A fondness for Ernie.
So this is interesting. In the article, it said the parents of these kids that had higher levels of screen time were more likely to be younger. So younger parents gave their kids more screen time than older parents.
Well, why is that? Let's think about that. We were not raised with devices, right? Yeah. The younger generation, it is what they know.
Right. So they probably had it when they were little.
We didn't have cell phones. Yeah. We didn't have tablets. That was not an era that we grew up in.
Do you know when the iPhone came out?
Wasn't it early 2000s?
I think it was 2007.
Okay. Yeah. Which really is not that long ago when you think about it.
Yeah.
I mean, when
Steve Jobs passed away in 2011.
Yeah.
Can you believe it's already been 12 years since he passed away? Yeah.
But when I was in grade school, not every house had a computer. That was, if you had a computer in your house, and we were not wealthy at all. We definitely struggled when I was younger. The only reason we had a computer is because my father was going to school for it. Do you know what I mean? So he was able to get his hands on one, but you didn't have that stuff.
I had a family member who sold PCs, desktop
Yep.
computers for a living, and I was able to get one from him.
Yeah.
But otherwise,
So
we wouldn't
wild.
have had one either. I mean, as a low end computer at the time was over $1,000. Now you can get a computer for a couple $100,
Oh,
I think.
easily.
Interesting how certain
With
things
a lot
get
more
cheaper.
processing power than it
Oh
had
my
back then.
gosh, yeah, it was a 286 processing
Hmm.
megahertz, I guess,
Yeah.
286, and then there was the 3 and the 4. Pentium came out. Those are all
So
outdated.
wild.
So listen, so the parents were younger. Uh, they had never given birth before. They had a lower household income, the ones with kids who had higher screen time, and lower education level. And they also tended to have more postpartum depression.
Wow.
So parents who had postpartum depression, lower income, lower education, younger, tended to allow their kids to have more screen time.
Yeah.
Interesting. I don't know how this
It
applies.
feels like an easy babysitter.
Yeah, I mean the study didn't check the screen time. I don't know if it was TV also included.
Uh,
What if they're watching football?
right.
Or
That would be totally
sports.
approved in our household.
That we don't count that as screen time. A meta-analysis involving studies with children under age 12 found that screen time spent on educational content was linked to improved language skills compared to other types of screen use. Parents viewing the content with their child also had a beneficial effect on language. We talked about that. So, they are recommending that we limit media use as much as possible for little ones, infants. Have an adult present when using a screen, um, and choose only the high quality programming. View media with your child, avoiding solo screen time.
Yeah. I mean, they're even saying when video chatting with a loved one. Do you know what I mean? So
Yeah.
I really do think they're taking in all digital,
Yeah, it's
like
every screen.
device screen time.
That's why we put away the laptops for the top podcast today.
Yeah.
We're going paper.
That's right. Going old school.
This doesn't count. Make sure educational information is age appropriate. And they talked about how it actually kind of becomes addictive, where if they are using a lot of screen time, it's very hard to stop. So what you may have to do is just reduce it, not try to stop it, because that's difficult to do.
Yeah. Yep, it's going to be necessary. And what's hard is we're living in a world now where devices and technology it's driving our world, and it's becoming more and more. It's not lessening.
I
So
don't know
as
how you could go without a
you
screen.
can't. I mean, Naveed and I, my oldest, were just talking about that on the way to school today. He's like, I can go a whole week without my phone. I've done it. I said, yeah, and isn't that great that you can do that? Like, there's a lot of people who really feel like they cannot put down their device. And so it ends up owning you as opposed to you owning it. So
Right.
it becomes problematic.
So speaking of parents, here's our next article. As maternal deaths rise, CDC says pregnant women report negative experiences at doctor visits. This was from USA Today. In a recent survey, 1 in 5 American women reported being scolded, threatened, or otherwise mistreated during doctor visits while pregnant, with higher rates of such maternal mistreatment reported by women of color.
Mm.
A new CDC study reports. The finding published on Tuesday emerged. So they were talking about maternal mortality rates increasing as well. So not only are more women passing away during or after childbirth, but a lot of them are being mistreated by their doctors. And I have the number here. This was crazy. U.S. maternal mortality rates, the women passing away, increased in recent years, jumping from 17.4 deaths per 100,000 live births in 2018 to 32.9, almost double, in 2021, according to CDC. And non-Hispanic Black women had a death rate nearly 3 times that of non-Hispanic white women.
Yeah, I mean, we need to look at that time frame too. And I hate to do this, but I'm always going to point back, because that is a time where our country and our families were under an immense amount of stress, right? Due to COVID, the pandemic, the shutdown, loss of jobs, forced
Yeah, I mean, those are the
vaccinations.
years where even the dad wasn't allowed to be in the hospital room
Correct.
when the mom was delivering.
Yeah, there's just so much. And so just know whenever we get into these and we see stats, I always try to go back and look at the stats before. You'd be surprised on how hard it is to extrapolate numbers from pre COVID times, during COVID times, and then now. Like the way everything is reported is so hard to read, but it's very clear that that time frame escalated a lot of issues and challenges in healthcare, more than just what we saw on the
Yeah.
surface. It was more than just COVID and the vaccine or lack of vaccine.
And I don't want to sound insensitive, but there's times where doctors, and I know a lot of doctors, being a chiropractor, we were around a lot of them. I know a lot of doctors get accused of mistreating their patient, but it turned out to be a misunderstanding. And the reason they found out it was a misunderstanding was because like the patient's spouse or sibling or parent who was right there said, no, 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 that's not what the doctor is saying. He's right or she's right. Relax, you're overreacting. So I don't know if they took those
That is true.
out of the study.
Well, but the other thing that we found during COVID is that in a time where people felt immense pressure, we took the stance in a lot of times we took the stance that we
You are contagious until found innocent.
well, and that we didn't have the time in that pressure cooker to allow patients to have a say in their health. That happened, and it happened a lot.
It's true. They were forced to do a lot of things they didn't want to do.
Yes. Yeah,
You're
very
right.
much. So, I mean, I've had experiences where I was talked to like I was an idiot
Right.
and I didn't know what I was talking about, or
Yeah.
the things that they said were really offensive.
Yeah, I mean, I constantly got yelled at because my mask would slip down while I'm at the gym working out. The trainers would run up to me and say, "Pull your mask up or get out."
Yeah.
They weren't trying to be rude or mean, but they certainly were
Right.
rude and mean.
Right. So you can see in the medical, environment in hospitals and whatnot, there is an immense amount of stress. And I think that we forgot that patients were people. I think that's not all doctors. I think some doctors stopped listening. A little bit of ego may have slipped in that time of stress, and we stopped listening to our patients. We treat them as numbers, not as human beings.
Infectious
Put your
numbers
ding
too.
dong laptop down and look at me as a patient and talk to me and hear me. I have one doctor who's done that, like truly done that. Do you know what I mean?
Yeah.
And we need more of that. You need to be willing to listen, because we can all learn things. You will learn about your patient if you talk to them.
Right.
It's not all about labs. It's not all about the diagnosis. You have to take time to listen. But that's not super important to me at all.
Well, what's important to you is hospitality and
Mm.
customer service.
It's very true.
And in medicine, for some reason, society thinks that medical doctors don't need to have a bedside manner to be good doctors. And I think that helps you feel better.
Yeah.
I think when a doctor genuinely cares about you and sincerely wants to see you do better,
Correct.
and they go out of their way to make sure your experience is good.
So that's about relationship.
It
And
helps
then when
you,
you
yeah.
have that relationship, you can take a firm stance with your patient and go,
Yeah.
I know this is your decision, but this is what I really believe is best for you. And you can tell them that,
Yeah.
but then it's their decision,
Right.
because their health is their responsibility.
So we have 3 children. Our pediatrician got in her car and drove to our house
Yep.
to do a newborn evaluation
Mhm.
for every one of the 3. How incredible is that? And that's relationship. That's
Yeah.
going above and beyond.
Yeah.
That's priceless. She literally said when we called her, we said, "Hey, we had another kid." She goes, "Don't bring the baby to my office. There are sick people here, and I'll come to your house."
Yeah.
And she literally came, sat down, examined the kids on the kitchen counter, brought all her equipment, and
Yeah. It was awesome.
and then we had tea and talked. It was an experience.
Yeah.
Amazing.
Yeah.
So old time doctors used to be like that. Here's something. 80% of those maternal deaths, the CDC says, were preventable. 80%. That's tremendous.
Yeah.
And it was a result of so they're talking about overdose, bleeding or hemorrhage, heart problems, and even suicide.
Yeah.
So they could have all been prevented. So it's sad that those numbers had increased during that time. The most common types of mistreatment reported were not receiving any responses to requests for help, being shouted at or scolded, physical privacy violated, threatened to have treatment withheld, or made to accept unwanted treatment.
Yeah.
Women without health insurance also said they experienced more mistreatment,
Yeah.
around 28% of them, similar to those with public insurance at 26%. In contrast, just 16% of women with private insurance said they experienced mistreatment.
I mean, it happens all the time. We have patients who said, "Hey, I don't want to give all the childhood vaccinations at once. I want to spread them out because I want to make sure my child's body can handle that." And their pediatricians, and this happens even here in Frederick, go, "You don't do what I say, you are not a part of this practice." And they kick people out.
Yeah.
So, it happens in all departments, and
Right.
we need to be willing to listen to our
Well,
patients.
and in this case, they're saying you don't have health insurance, which means you're probably not going to pay me,
Right.
and I'm going to mistreat you. And I think that's heartbreaking.
Yeah.
Or you have public insurance, which means you're going to cut my fees by 50%. And so I have the right to mistreat you because this is a public
Right.
facility. Or sometimes some of the public places for lower income people, they hire lower level employees and don't spend enough time and money training them
Yes.
to treat people properly.
Correct.
And that's one of the reasons. But this part of the article broke my heart.
Yeah.
It's very sad. Someone who's already destitute, someone who's already in need, someone who already has low income shows up for care and they get mistreated because of their economic status.
It's not okay.
And that is absolutely wrong. So they all need to stop that. People deserve our respect, appreciation, and love,
Yeah.
no matter where they are and who they are. Next article is statewide outbreak of meningococcal disease linked to 5 deaths in Virginia. This is from USA Today.
Yes.
And you're like 5 deaths. That doesn't seem like a lot, but 5 deaths in a small area is significant. So don't discount it. Richmond. This is where the article was from. An outbreak of meningococcal disease in Virginia is growing. State health officials announced this week, and nearly a half dozen people have died as a result of the eruption. According to the Virginia Department of Health, 27 cases of the disease caused by a bacteria called Neisseria meningitis type Y. Man, does that mean there's all these other types too? I mean, there's 26 letters in the alphabet. Y is
Makes me
second
a
to
little
last.
nervous.
So type Y is the one that's killing people now. Type Y have been identified in eastern, central, and southwest Virginia since June of 2022. A vast majority of the cases have been among unvaccinated individuals. The department said Black adults between 30 and 60 years old make up the majority of the cases. So most of the 27 were Black adults between age of 30 and 60. Very interesting.
Now, this isn't a required vaccine, though, is it? So I
I
would
don't think so
say,
because they give it to kids. I think the article said between age 12 and 14 or something like that.
right. So then I think that's an interesting statement, because if it's something that is not required, majority of people probably
Yeah.
have
They,
not
they,
been
they give it to
vaccinated.
kids at age 11 or 12 with a booster that needs to be given 4 years later.
Hmm. Now, how is this contracted? Because it's not as contagious as, so while 5 cases, right, is big for a small area,
Yeah.
we also need to say this is not as contagious as the cold or the flu. So don't freak out. Don't, you know what I mean?
True.
Just don't share.
It says it's rare, but
Yeah.
the illness is often severe. Um, the bacterium is often found in the nose and throat of people without causing the disease.
Yes. So coughing and kissing are sharing drinks, sharing
Right. You
utensils.
have to be very close
Yes.
for a long period of time.
Yes.
So literally kissing, coughing and sneezing in their face. Like they have to like literally come up to you and cough directly in your face, and you have to be inhaling at the same time for you to get it.
Yes.
And then sharing drinks, sharing cigarettes, sharing utensils, things like that. Um, and so it doesn't talk about how the first person got it.
I know.
Because if you're getting it from another person, that person had it.
Yeah.
So, but it doesn't say that. Symptoms can first appear flu-like, may soon become more severe. Um, Disease can be treated with antibiotics. What else? Fever, chills, headache, stiff neck, nausea. Any meningitis is going to cause severe stiff neck. So not just like, hey, I heard a little bit turning this way. It's like every movement is stiff. Nausea, vomiting, rash, sensitivity to light. Because it affects the brain, that's why you have sensitivity to light. Obviously, the CDC recommends vaccines. That tends to be a controversial thing with a lot of people at this point. I don't want to get too far into that word, and there's different definitions of the word vaccine
Yeah.
today. But you can prevent this by not sharing toothbrushes with people who are sick.
I do find it interesting that they do say that genetic sequencing is available, or of available specimens has confirmed the cases have highly genetically related.
Interesting.
So I bet we'll end up hearing more about that as we go down. Maybe there's a genetic disposition that
Right.
someone has that makes them prone to,
Yeah.
Well,
we also know with through epigenetics, you actually can activate different genes
Oh,
in the
yeah.
body. People have cancer genes and never get cancer, and there's people who don't have the cancer gene get cancer. So there's a lot of environmental factors, and I know that if you're immune compromised, you're way more susceptible.
Yep.
The wind blows, you're going to get sick. If you take care of your immune system, that's not going to be the case. How do you boost your immune system? You take your vitamins, vitamin D, zinc, sunlight, exercise, proper nutrition, fruits and vegetables,
Lots of water.
no sugar, and sleep. Sleep. I think so. So your adrenal glands, which release adrenaline, are so closely tied to your immune system. When the adrenals get fatigued, your immune system tanks.
Yeah.
That's why when you pull an all-nighter, the next day you're susceptible to catching a cold. When you're getting ready for a vacation, the week before you go to vacation, you work
Right.
twice as hard, right? And then you're packing, you're trying to prepare, you sleep less that night. Then you get on an airplane and everybody coughs around you, and then you arrive in paradise for your vacation and you're sick, and it's because your adrenal glands were weak.
Right.
So support your adrenals by sleeping properly,
Absolutely.
and you won't have to worry about these strange diseases. Do we have time for one more? I think we have time for one more.
Okay.
Cardiac arrest. Men and women have different symptoms, the study finds. This is from Medical News Today. Of the more than 356,000 cardiac arrests, I didn't know there was that many, because I thought there'd be, there aren't as many cardiac arrests as there are heart attacks, but that's a big number every year.
It is a big number, but
And-
I will tell you, I searched high and low, and there's my biggest concern with this number going into this is that I cannot find a singular number like that differing from 2018, 19, 20, 21, 22. When I try to gather that information, I cannot get it.
It's not available.
And I find that very, very fascinating. I went through all the different major, CDC, American Heart Association, all of those, and I cannot extrapolate that.
So we don't know what the number was prior to 2021.
Correct.
Interesting. Well, definitely, it's been in the news a lot. I mean,
Yes, it has.
Just to be honest, even I, as a health practitioner, health provider, I wasn't sure exactly if there's a difference between heart attack and cardiac arrest, but there is a huge difference. Now, as a chiropractor, I just need to know it's a heart problem. But still, cardiac arrest is an electrical issue. It's when the heart just suddenly stops beating for electrical reasons. Heart attack is when an artery gets blocked with plaquing or a blood clot, and it stops flow of blood to a part of your heart muscle. That part of your heart muscle starts to die, but the rest of the heart is still alive, and it doesn't fully stop beating. It just beats irregularly, and that's why survival rates from a heart attack are way higher, and they've improved tremendously over time. But when it's an electrical issue and you're just going about your business and suddenly the heart stops and you can't even say, hey, something might be wrong. You just stop and collapse. It's very scary. It says 90% of cardiac arrests are fatal. While there are some known signs of sudden cardiac arrest, it usually occurs without warning. Researchers from Schmidt Heart Institute, I won't say all of it, found that half of people experiencing a sudden cardiac arrest also had a telling symptom 24 hours beforehand. Scientists also discovered those warning symptoms are different between men and women. And what the article also said is that most people ignore those symptoms.
Well, here, I was thinking about this. Most people don't know what it feels like to be normal.
No, that's
for
a good
their
point.
body to function the way it was intended to,
Very good point.
because
Yes.
of all the toxins we load our system up with, because of all the trauma, because of the inability for the body, for the brain to communicate with all the muscles, tissues, organs, cells in the body. We don't know. What is the most common thing we hear from patients after they start getting adjusted?
I had no idea I could feel this good.
100%. So if we don't know how we're supposed to feel, how do we know when something is wrong? Right? You don't.
Yep, you don't. Exactly. It's like when you're driving a really nice car every day, and then someone puts you in a Rolls Royce.
Yeah.
And you drive that for a day, and you go back to your really nice car, all of a sudden it doesn't seem as nice.
Right.
And so, like you said, we don't know. But the original study was published in the journal Lancet, which is a very reputable, prestigious, peer-reviewed journal. Main cause of sudden cardiac arrest is an arrhythmia, which is irregular heartbeat. An arrhythmia occurs when the electrical pulses telling the heart to pump blood are disrupted. It's different from a heart attack. We talked about that. If someone has had a heart attack, then cardiac arrest is more likely. Sometimes they faint and become unconscious. Signs of cardiac arrest are racing heartbeat, dizziness, chest pain, shortness of breath, wheezing, nausea, and vomiting. Better call 911 right away. Early intervention is important. Chest compressions, defibrillation, and post-arrest care can increase survival rates. And most individuals tend to ignore the warning symptoms. So what are those warning symptoms? Is they experienced at least one telltale symptom 24 hours beforehand, and those symptoms included shortness of breath, chest pain, excessive sweating, and seizure-like activity.
Now, most generally, what it states a little bit further along is that for women, it's typically shortness of breath because it is different.
Yep.
For men versus women, and for men, most generally, it's the chest pain.
Chest pain.
But not always.
Yeah, but and those are things you shouldn't ignore anyways, even if it's not a cardiac arrest issue. Like,
Yeah.
you get shortness of breath. You didn't have shortness of breath. Now you have shortness of breath. Go get it looked at. It's an emergency. If you have chest pain, men especially, you guys, they're working. Like, my chest started to hurt. But it's not on the left. It's in the middle. Or it's on the right. Who cares? Get your butt to the ER and get it looked at. What's it going to hurt? Even if you get mistreated at the hospital, like the other article. Men are far more likely to suffer sudden cardiac arrest. 2/3 of victims are male. Women tend to present with this condition an average of 8 to 10 years later in age. So younger in men, older in women.
Yeah.
Women live longer too.
We can live without you guys.
That
is what the stats show.
I think we're just afraid that there'll be no one to take care of us. So we're like, let me go first.
For sure.
Women with unexpected shortness of breath have a 3-fold higher risk of an imminent sudden cardiac arrest. Men with unexpected chest pain have a 2-fold increase.
Yeah.
So it's really critical for women. You experience shortness of breath, go get it looked at. Now, this part bothered me. This part in the article bothered me and made me a little scared because they're saying, oh, if we find it and we catch it early before the actual cardiac arrest, we know how to treat it. But then all the treatments are for preventing heart attacks, not cardiac arrest.
Yeah, I know. What's really funny is we go through these articles separately, him and I, and as I'm reading through this, I'm talking to Sean. I go, "What is this? Why would they do this? Why? What?
Yeah.
This doesn't make
So
sense."
let
according
me
to what I
read it
read.
to you. Certain types of coronary blockages. So this is treatments they're going to use. So they go if you have chest pain, you go in. They're going to check for coronary blockages, which is the arteries that feed nutrients and oxygen to your heart muscle itself. It's not the blood that's in your heart. It's the blood that feeds your heart muscle. It could be opened up percutaneously or through bypass surgery with open heart surgery before the event happens. But they're saying cardiac arrest doesn't have blockages, so that's what confuses me about this.
I know.
It's like they're saying, oh, if we catch it early, we can fix it, but all they're doing is preventing the heart attack.
Right.
It says there are also many medications that can stabilize coronary plaque. Again, it's not a plaque issue, but it's talking about that, such as statins, which is cholesterol-reducing medication, and aspirin, which thins your blood. Of course, fish oil and vitamin A and E do a better job with thinning your blood, but I'm not going to say any difference. The medical doctor is the expert. We follow their advice. As well as medications that help with heart function and prevent arrhythmias that lead to cardiac arrest, like beta blockers. Again, beta blockers stop the fight or flight response in the body or slow it down. One of the problems with beta blockers is because they block the beta adrenergic receptors in your body. Adrenaline doesn't have as much of an effect on increasing your heart rate as it would without the beta blocker. The problem is the catecholamines that build up in the body when we're stressed continue to build up. If they're not hitting those receptors, the body produces more and more and more to get the same response. And when you stop taking the beta blocker, all of those catecholamines hit the receptors all at the same time, and you get this huge surge in blood pressure. And then that's when the doctor says, I told you, you can't ever stop taking your blood pressure medication. So if you're starting on something, make sure you're talking to a good doctor who understands this information and is being proactive about not letting things like that happen.
Yeah.
But again, I don't see how any of this, it would prevent. So even if they catch it early, let's say I have chest pain today, and I go, that means in 24 hours I'm gonna have cardiac arrest. So let me run to the ER, and I go to the ER, and if they're checking for blockages and old heart attacks, and let's say there's no blockages in the coronary arteries, my heart rhythm is fine, everything's normal, but I'm still gonna have a cardiac arrest. I don't know how they would prevent that. Maybe they keep you 24 hours and monitor you, and 24 hours later, if you didn't have cardiac arrest,
Well,
they let you go.
there was one in here. There was one sentence that talked about the potential in the future of using AI as a predictor,
Yes, I
right?
saw that.
Which I think is what actually this would all lead to, right? Because if we think we know what normal is in the body, right? Or what that person's normal is, and we have a baseline, and they can figure out some kind of component that would then, measure those things. I think that's what they would.
Yeah.
So who knows? Maybe we could use AI to see those 24-hour in advance symptoms that are so minor.
Right.
Maybe AI could interpret that differently than we can.
AI is artificial intelligence, not aromatase inhibitors.
Yes.
Both are abbreviated as AI.
Oh, yes.
So because aromatase inhibitor is a drug, it blocks conversion of testosterone to estrogen. If there are people listening who are familiar with that, probably not. But anyways, that's just how my brain thinks. AI is artificial intelligence. Good information. I think that was good. We have so much more to talk about. So we will be back with you soon. Join in again next week, please. We're so grateful that you watch and you listen. And if you decide to like the podcast or this, they took the dislike
You
button
can even
off.
love it.
I know, but I wish that dislike button was still there, so I would know how many people dislike our podcast. I'd like to know that. But if you
I like to be
dislike
in the
it
dark
or
with that.
anyway, go ahead and comment. Let me know. I won't share it with Brandi. Obviously, she doesn't want to know, but I will respond. And and we will talk about that. Upcoming podcasts. Someone showed us an article which is kind of old. It's back in March, but it talked about how chiropractic is dangerous. I'm a chiropractor, so if you are interested, comment and let us know. Hey, I want you to talk about that. I want to know if chiropractic is safe or if it's dangerous, what the dangers are, what the risks are, what the side effects are, what the benefits might be. Do they outweigh that, and how many people go and all that stuff? Be happy to dedicate a podcast to that. It'd be a lot of information. It'd probably be an entire podcast.
Yeah.
And we have other information like how we can detect things early. Magic mushrooms. We're going to talk about that on the next
Woo!
podcast as well. So
Excited.
please tune in, and we love you. Appreciate you. Take care.
Thanks.